Hi and Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad Dinan Saifuddin bin Muhammad Dinain. Me and my groupmate Muhammad Alif Daniel bin Jama'il Hasmadi, Nurin Akilah binti Mazlan, Nur Ashkin binti Harun, and Ainu Shanifah binti Johari will present about the injury that might happen in running. So, running is a common sport or exercise that many people do it. Some of them do it for professional. There are also some people start running to lose their weight and also do it for fun. So, some of them forget that there are also injuries that might happen during running. For example, heat exhaustion, nosebleed, hamstring, ankle sprain, and also Achilles tendon tear. Next, I will pass it to my groupmate to explain it in more detail.
Hi and Assalamualaikum. My name is Ainu Shanifah binti Johari. So right now I will explain to you how to treat the nose bleeding. So nose bleeding can be happen to you if your temperature body are changed and your nose become dry. And nose bleeding can be happen to you if you are picking your nose very hard. So you can take a few steps to treat the nose bleeding, and if the bleeding are not stopped, you can call the medical to get the further treatment. So I will demonstrate to you how to treat the nose bleeding. In this situation, the athlete running and her nose is bleeding. After that, the first aider realized and brought her to a safe place. After the athlete sit down, the first aider asked her to lean forward and give her a handkerchief to wipe out the blood. After a few minutes, she wiped out the blood until the blood is gone. The first aider asked her to pinch the soft part of her nose for 10 to 15 minutes. After a few minutes, the first aider gave the athlete an ice pack to place it on the bridge of the nose. This action takes about 10 to 15 minutes. Stay upright rather than lying down to reduce the blood vessel of your nose, and it will be discourage further bleeding. That's all.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Ashkin binti Harun from class SR113 4B. For this task, I would like to show you how to do the treatment and for ankle sprain in the running sport. So let's go. For your information, ankle sprain can occur when the ligaments are overstretched. The amount of pain and swelling depend on the severity of the ligament tear. As you can see, this is for situation for ankle sprain injury. In this situation, I'm using the RICE treatment concept, which is we focus for the rest in ankle to reduce pain and further damage. And next, we ready for eye. Eyes is for eyes. Apply an ice pack immediately following injury for 50 minutes and repeat for every 2 hours. And now, C. C is for compression. Apply ice and compression can ease the pain, reduce swelling, muscle sprain and bruising. And last is E, stand for elevation. Raising your ankle to or above the level of your body, it will help prevent the swelling from get worse and will help reduce bruising. That's all from me. Thank you.
Hi, Assalamualaikum. My name is Nuri Akila Piti Mazlan and I am from SR0134B. Okay, now I will explain the other injury that will occur when we doing the running activity. It is hamstring strain or pull. Hamstring strain is sometimes called a pull hamstring. Happens when one or more of these muscles get stretched too far and start to tear. Hamstring strains can be mild with little pain and a short recovery time, or they can be severe and surgery and crutches for weeks. Alright, the treatment that we can get from this injury is first, you need to do the victim assessment and first aid care. For the victim assessment, I will use the STOP assessment. Alright, now I will explain what is STOP assessment. Okay, S is stop. Stop the athlete from moving. T is stop to injured athlete. What happened? How did it happen? What did you feel? Or where does it hurt? Next is O. O is observe. Observe while talking to athlete, look for the signs of obvious injury such as bleeding, wound, fracture, burn, swelling, bruising, or any other type of observable deformity or sign. Lastly is P. P is prevent from any further injury. The treatment that needs to do is rise. The athlete needs to rest leg from doing any tough activity, then put the ice on the leg to reduce pain and swelling. Compress the leg by put a bandage, and lastly is elevation. Elevation or raise the injured part above the heart when resting to help with swelling and pain. The RICE method is best able to treat mild or moderate injury such as sprain, strain, and bruise. If a person has tried the RICE method but experienced no improvement, or if they are unable to put any weight on the injured area, they should seek medical attention. Okay, now I will show you the role play or example of how the first aider handled the situation when the athletic athlete injured his hamstring. So let's go. As you can see here, athletes are running for warm-up before they are going to track for their competition. But suddenly, during their 4 laps, one of the athletes got injured and his fellow friend see him and try to help him. He lift up his friend to the safest place from people. And then he asked for his current condition before the first aider came. When the first aider came, she is asking what happened, how does it happen, how bad the pain scale is, and the first aider immediately do the treatment. She do the treatment with ice. She applied the ice on the injured part, which is hamstring. Actually, you need to open the trap, but because of some problem, he cannot open it. But the proper way to treat is you need to open it and put directly on the injured part. After she applied the ice, she put a compression on the injured part of the athlete to make sure that the injured part is not swelling. After the first aider treat the injured athletes, she is asking the other athlete to shove his friend out of the field to get the further treatment.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Alif Daniel bin Jamil Hasmadi. I'm from SR134B. So today, for the running sport, injury, I will explain about heat exhaustion. So usually running athletes training under the hot temperature that can cause them a heat exhaustion. So the definition of heat exhaustion is one part of the spectrum of heat related illnesses that begins with heat cramps, progresses to the heat exhaustion, and finally to heat stroke. It is caused by a loss of salt and water, usually through excessive sweating. It develops slowly and usually happens to people who are not used to hot or humid weather. For the sign and symptom, a headache, dizziness and confusion can be felt when someone got heat exhaustion. Next is a loss of appetite and feeling sick. Third one is sweat with pale and clammy skin. Cramps in the arms, leg and stomach. A fast weakening pulse and breathing. So now for the treatment of heat exhaustion, I will show you in the next video.
When someone is suffering with heat exhaustion, get them to a cool place. Firstly, we need to lie them down with leg raised. By put back under their leg, it can help to return blood back to the body, which increases the circulating volume to the vital organs. Next, cool their body temperature by apply ice pack to their upper body for a few minutes until the body temperature decrease. Next, give them a lot of water, especially isotonic drink, to replace the salt and the fluid that they have lost through sweating. Lastly, keep checking their level of response to know their body condition. If it's become more worsened, we need to activate the emergency medical service.
That's all from me for heat exhaustion injury. Next, I will pass to my friend to explain about other injury. Thank you.
Hi and Assalamualaikum warahmatullahi wabarakatuh. My name is Ahmad bin Saifuddin bin Muhammad Dinain. In this video, I will give you the explanation of Achilles tendon and also the symptom. After that, I will show you the demonstration on how to treat the Achilles tendon tear. Okay, first, Achilles tendon tear is a condition marked by a partial tear of your Achilles tendon at the back of the ankle. For your information, Achilles tendon is the strongest, largest and the thickest tendon in the body stretching from the body heels to the calf muscle. Tendon enable us to do various types of activities such as walking, running, jumping and standing at the balls of our feet. This tear always happen to the person that active in a sport. It is because of the high impact that they receive from the running and jumping. Although it mainly focus on the active person, it also can happen to anyone because of their age and their fitness level. Males are the most common to get this injury than female. For the symptoms, at first they will hear a snapping sound or feel a weight sensation at their leg. After that, they will have some difficulty to walk, especially when they need to walk upstairs or up hills. And for severe cases, they will have trouble to even standing properly. That's all from me, thank you. After that, I will show you the demonstration on how to treat the Achilles tendon tear. Why? Did you hurt yourself?
Yes, I hurt myself.
Where did you hurt?
I think it's on my Achilles tendon.
Okay, let me help you. First, you must remove his shoes and his stockings. This is to check whether he has any injuries or not. After that, you can put ice on the injured part. The function of the ice is to reduce the swelling. If the ice doesn't put at the injured part, then the swelling will become worse. Next, you must bandage his injured part. Bandage and dressings are both used in wound management. The bandage can be used as a piece of cloth or other material used to bind or wrap the injured part. Bandage can be either placed directly against the injured part or used to bind a dressing to the wound. The purpose for dressing is to protecting wounds, promote healing, and also provide comfortable for the patient. Bandage can be used also to hold dressings in place, to relieve pain, and generally to make the patient comfortable. That's all from me. Thank you for watching. In conclusion, warm-up and stretching is very important. It is because to prevent any injury to happen. Some of them know that stretching is very important, but they become lazy when it comes to stretching. So, warm-up and stretching can take to 5 minutes or 10 minutes. But for professional, they maybe need more time to do the warm-up and stretching. That's all from me and my group. Thank you. Assalamualaikum warahmatullahi wabarakatuh.